about how brief introduction to our bone marrow transplant program and about FACT accreditation. So, to talk about hematopoietic stem cell transplant and also called bone marrow transplant at Ramaiah Memorial Hospital, our bone marrow transplant was inaugurated in the year 2015. The BMT consists of 5 transplant suits which are HEPA filtered and have continuous positive pressure, temperature and humidity monitoring to ensure sterile environment, and was the initial infrastructure that was inaugurated. We perform more than 225 transplants till now, and we have transplanted between the ages of 1 year child to a 69-year-old person. We offer transplants to care for everyone, whether funded through Indian government programs or private insurance or coming from abroad. Our vision is expanding access and delivering international standard care in low middle income country like India. Our mission is to provide equitable, evidence-based and safe transplant care. Under the mentorship of Professor Damiano Rondoli, Director of Bone Marrow Transplant at the University of Illinois Chicago, we launched the program in 2015 with a core team of 3 physicians, 1 coordinator and 1 hematopathologist. In the program's early phase, we visited University of Illinois at Chicago to understand clinical workflows, infection prevention protocols, infrastructure design, and outcome monitoring strategies, insights that directly informed our local protocols and staff training. Early priorities were reputation building to generate sufficient patient referrals, opening a dedicated hematology ward with private rooms for leukemia inductions, and initiating targeted fundraising. These efforts were later showcased at the American Society of Hematology in 2019 Global Capacity Building Showcase. In the next phase, we commissioned a state-of-the-art stem cell laboratory for collection, processing, and cryopreservation of cellular therapy manufacturing products. We also participated in the FACT India working group meetings, gained access to FACT resources, and got mentored from other accredited centers and established formal reporting to the CABMTR. We also hosted multiple visits from our advisor, Dr. Nadeem Mahmood from the University of Illinois at Chicago, whose guidance was instrumental in strengthening our quality management program and refining key clinical and operational processes. This is a pie chart that shows distribution of adult transplant diagnosis in our program. Multiple myeloma forms the largest group of nearly 45%, followed by severe aplastic anemia at 13%, acute leukemias, lymphomas comprising of remaining major indications. The program has done a few transplants for autoimmune diseases like multiple sclerosis for patients referred internationally. This chart represents our pediatric transplant diagnosis. Severe aplastic anemia accounts for the largest group at 20%, followed by beta thalassemia at 13% and inherited bone marrow failure syndromes at 12%. Acute leukemias together form about 16%, with the remaining including CML, MDS, and select solid tumors and immunodeficiencies. We have also performed a few transplants for rare pediatric metabolic and immune disorders. This is our organogram. We function under the strong institutional leadership of Dr. Nagendra Swamy, Chief Executive, and Dr. Madan Gaikwad, COO, ensuring sustained administrative and financial support. The Cancer Center is led by Dr. Harish, and I oversee the bone marrow transplant program. Our core clinical team includes a transplant physician, Dr. Rashmi Palaseri and Dr. Nishil Gowda, supported by oncology hematology fellows. Nursing is led by head nurse Rama Devi, and clinical pharmacy is led by Dr. Betsy. Ms. Mamata is our data manager who maintains registry data and quality metrics. Our work is supported by a wide range of specialists from cardiology and pulmonology to nutrition and psychiatry. Ensuring holistic care, our state-of-the-art stem cell facility includes apheresis and processing units led by Dr. Deepa and Dr. Sujita, and also supported by skilled technologists and laboratory staff. Dr. Ankita ensures who is the quality manager, ensures integration of clinical and laboratory services and maintenance of compliance with international standards. This diagram shows a BMT inpatient unit and support areas. The unit includes 5 transplant suites and a duty doctor room, dedicated patient family rooms for extended stays, and quality management and counseling area, ensuring integrated clinical operations, patient comfort, and privacy during treatment and extended follow-ups. This slide highlights our stem cell facility, which is strategically located adjacent to the blood bank for optimal workflow and safety.